Is ginger useful for diabetes nutrition? In one reported case of successfully managing type 2 diabetes with a lifestyle intervention, a 45-year-old man took responsibility for his health in his own hands and tried to beat his illness and stop medicines by taking foods that are supposed to cure diabetes. But how strong is the evidence for ginger, for example? Diabetes reaches pandemic levels and requires safe, affordable and effective treatment therapy, so what about the ginger potential for prevention and treatment? Well, in Petrie's judgment, the increased exposure to ginger improves blood sugar absorption of muscle cells almost as much as the popular drug in diabetes metformin. And in rats, ginger can work even better than metformin. But the weight loss and blood sugar levels seen in rodents are not necessarily valid for humans. In this study, a combination of supplements leads to loss of the body weight of mice in 1 month. What about humans? No benefits compared to placebo. There is no way of knowing if something works in humans until a study is done. For a list of natural foods that you can help you reverse your diabetes. If you give people white bread with refined flour with 1 glass of water, here's what happens to their blood sugar levels over the next 2 glasses. But if you give them some unsweetened green tea with white bread instead, there is a smaller increase in blood sugar levels. It's the same with cinnamon tea and ginger tea, which is made by mixing a tablespoon of grated fresh ginger in a glass of hot water. Okay, but these are healthy, normal people. How about the effect of ginger on diabetics? This was the first study of its kind. Diabetics divided into 2 groups, with some taking 1 teaspoon of ginger powder a day for 2 months, hidden in the form of a pill so that they can compare it to an identical-looking one, a placebo sugar pill, and it turns out that the addition of ginger lowers insulin levels, which is a nice thing, and it lowers triglycerides and cholesterol, but without significant effect on blood sugar levels. C. Heart disease is the leading cause of death for diabetics, so a drop in cholesterol will be reason enough to split with the yellow pennies that will cost you to add that amount of ginger to your food, but it would also be good to see an improvement in blood sugar control. There is a decrease in insulin levels, suggesting improved insulin sensitivity. And there is indeed a significant drop in insulin resistance, so maybe they just didn't give them ginger long enough to work. It's been 2 months. What about 3 months? Even less ginger, less than a teaspoon a day, but in 12 weeks, and maybe ginger can lower blood sugar levels though, and also to reduce inflammation by having reactive protein levels by half. How about we go back to just 8 weeks, but this time to use a bigger dose of ginger, 3 grams a day or about 1.5 teaspoons. And we have a significant decrease in fasting blood glucose levels, as well as long-term blood sugar control in the ginger group, thereby establishing the effect of ginger on diabetes control. Look this, the placebo group continued to deteriorate, the ginger group has improved. Similarly, an incredibly randomized, double-blind placebo control study compares 1 teaspoon a day for 12 weeks with 1.5 teaspoons. Other foods available at your local grocery food that can contribute to this are listed here. Everyone was better in the ginger group, everyone got worse in the group without ginger. All significantly different, just for a small, inexpensive, safe, simple spice with no side effects. If we take all the studies together, we will find that they clearly show that ginger it can lower blood sugar levels and improve long-term blood sugar control at a perfectly tolerated dose. You can just put 1 teaspoon of ginger powder in 1 cup of hot water and just drink it. So, in general, adding a little spice to one's life can be helpful for a tasty and sensible way to maintain a healthy body. If you are interested in learning about more foods that could significantly reduce your blood sugar levels. Thank you for watching.